Hello, I'm now joined by Bernard Pécoul, Executive Director of DNDi. Bernard, thank you for joining us. To begin with, Bernard, what do we mean when we talk about the elimination of neglected diseases? What are the diseases that we're talking about?
So we are talking about diseases such as sleeping sickness or Leishmaniasis, also called Chagas. Those two diseases are parasitologic diseases, so transmitted by a vector, the tsetse fly in a case of sleeping sickness, the sandfly in a case of Leishmaniasis. So they are very frequent in Africa for the two, and for Leishmaniasis they are also prevalent in Asia and Latin America. Those diseases could be eliminated if we combine control activity in terms of prevention, so the diminution of the risk of transmission and controlling the vectors, and having a good treatment that could be implemented at a local level.
What are the short-term and long-term strategies in research and development that are available?
So in terms of research and development, we have used a short-term strategy trying to improve existing tools and to adapt those treatments to the condition in the field. So it was the first strategy, but this strategy is not ambitious enough and will not be good enough to support elimination. So we need new candidates corresponding to much more complex criteria. So to be used as oral drugs, for example, at a village level with a very simple diagnosis. Today we are still, in the case of sleeping sickness, for example, we are still using injectable treatment that need to be managed in treatment centers, so with quite a lot of staff and support technically. In the future, what we are expecting to do is to have something that could be used at a village level with people with a minimum of training.
What kind of partnerships are needed?
To be successful in research and development for this kind of disease, you need to have at a certain level partnership between private partners, so pharmaceutical partners, biotech partners, with public institutions, researchers, and particularly at a country level. Concerning the researchers, particularly when we enter into the clinical development, so the clinical testing, we need to have a very strong partnership with local researchers and with people working at the hospital level. So we need to train doctors, nurses, lab technicians. We need to strengthen also the technical facilities in order to do very good quality clinical studies in difficult settings.
And how can capacity building and technology transfer be improved in endemic countries?
For DNDi, capacity building and transfer technology is key because we think on a long term and on the sustainability of the model. So we cannot imagine that on a mid-term research and development for that kind of diseases will be sustainable if we are not engaging the government on one side, but also the research community from the country in developing solutions. So it's why many people have been trained in the past. So we are trying to use existing capacity and strengthen capacity at a local or regional level.
What's the next big milestone for DNDi?
During the first 10 years of DNDi, we have the objective to deliver 6 to 8 new treatments for those diseases. So today we have reached a level of 4, so we still need to have 2 or 3 additional treatments. And within this treatment, we want new drugs that we can select from the beginning, so from discovery, and corresponding very specifically to the characteristic of an elimination program. So a very simple treatment, short course treatment, oral treatment, and without major side effects in order to be used at a village level with the support of primary health workers.